Hello, I am the professor of otolaryngology department of Istanbul Medical University, Dr. Muhammed Fatih. Today I'm going to make a presentation on the indication for the installation of cochlear implants. But before that, I would like to briefly discuss the subject of hearing loss. It is currently believed to be a serious health condition because out of 1,000 of the newborn, we observe 1 to 3 children with hearing loss. Also, there is age-related hearing loss, and about every third person who is over 60 years of age has this problem of hearing loss. Also, we can observe it in some health conditions, even in younger age, such as meningitis, chronic otitis, or cholesteatoma. And generally, we attempt to tackle the issue of hearing loss by using the traditional hearing aids. Unfortunately, in some cases, they do not solve the problem, and in such situations, a cochlear implant would be necessary. But why is it so important to solve the hearing problem? Well, when studying the hearing loss, researchers also noted that it is connected with the loss of communication abilities and memory. People are getting their signals from two main sources, from their eyesight and hearing, and this becomes increasingly important in the older age. If the person does not hear well, they limit their contacts with the outside world. They are afraid of being misheard, they are afraid of giving the wrong answer, and by closing down, they create conditions for the development of dementia or the Alzheimer's disease. Therefore, it is very important to hear even in the older age, because for the brain to work, it needs to get signals. Such signals are usually obtained through hearing and seeing. So how does a person hear? As we know, the hearing system consists of the outside ear, the middle ear, and the inner ear. Actually, the outer ear and middle ear are not that important in the process of hearing, much less important than the inner ear, which is mostly responsible for hearing. And inside there is a so-called acoustic labyrinth with hair cells which receive the sound and transfer it to the brain through the 8th pair of nerves. Some part of those hair cells are suitable for high-pitch sounds and some of them for low-pitch sound. And if those hair cells do not work, unfortunately, no sound goes through the hearing nerve. The deterioration of such hair cells can be due to some hereditary disease or because of some disease at a later age, such as maybe meningitis. Also, there is some age-related loss. A person first loses ability to hear high-pitch sounds and then other sounds as well. Hearing loss can be classified into 3 types. Conductive, associated with the possibility to conduct sound. Also, the neural type of hearing loss and the mixed type. The conductive hearing loss usually has to do with the problems with tympanus and also the tissues of the middle ear. And also there are neural type hearing loss, which has to do with the hair cells and also with the 8th hearing nerve. So the problem we are considering now is the sensorineural hearing loss. The usual treatment that we recommend is the correction of the tympanus or the operation on the mid-ear if they are able to solve the issue. However, if there are some neural problems as well, we recommend to use the classic hearing aids, which can be effective in cases of simple hearing loss. But if this hearing loss is at a more advanced stage, unfortunately, those hearing aids would be not effective. And there are some more effective methods. The implants of the mid-ear, the so-called BACA devices, we also use them. But also recently we see quite a dynamic development of cochlear implants, and in the long term they make a lot of benefit for the patient. A cochlear implant is an electronic device which implements the functionality of the labyrinth in case it doesn't work. The implant consists of the outer and inner parts, which are connected by means of magnet. The sound that is obtained from the outside with the use of a microphone is transferred through the electrode and then through the hearing nerve to the central nervous system. And is this method reliable? Well, actually, when it was developed, a number of problems existed, but thanks to the development of the technologies, those problems were solved, and right now this operation is not much different from any traditional operation, such as, for instance, a dental implant. And historically, the development of such implants started in the 18th age, and in the 18th century, people started from sending electric impulses to the ear. Later, when people learned to get a response from that tool, the development continued, and in 1984, the United States Food and Drug Administration approved its first implant for the adults, and later in the 1990 the first implant for the children of 2 years of age, and later in the year 2000 for the children of 12 years of age. And this is exactly the age at which children are suitable for implants in Turkey. We have two major companies, Medal and Cochlear. There are some other companies as well, AB and Oticom, but the first two ones are the most active and made a huge contribution to the development of the implants. So right now there is a huge progress in this field, even some robotic operations. So we are using the implants of two of those companies. The companies are Medal and Cochlear. So I will briefly explain about the inner part of the implant. Inside there are two important elements. One is the electrode, which is introduced to the labyrinth, and the second part, which is the receiver, is implanted under the skin. And if the patient has hearing loss at the advanced stage, we use some surgery to introduce the electrode, and the receiver is connected to the outer part with the help of a magnet, and the microphone collects the sound and transfer it to the inside part by means of electric signals. The inner parts can be different depending on the manufacturer, but generally they have this magnet part with the sound processor and the electrode part. And the electrode part may be slightly different depending on the patient's need. If the patient has not sufficiently developed labyrinth, we can use a short electrode. Also, for a child with some special anatomic features, we can select electrodes with specific features. So how does an implant work? The outer parts with a wire are almost not used anymore. Right now we are mostly using a more compact outside part, and only a small part of it is visible under the hair, and it is connected with the magnet on the inner part. So such devices are using in the recent time, and we see increasing use of such devices. Also, the majority of companies enable rechargeable batteries in such devices. So the sound is connected by the microphone and transferred by means of the electrode to the hearing nerve. There are some contraindications, especially in case of hereditary hearing loss, with hearing loss over 80 decibels on both sides. Some scanning then is required, scanning of the hearing system, and we run such scannings for almost all children within the first 6 months of their life. We try to discover hearing loss on this early stage, and if we are noticing such hearing loss, we also perform some additional checks using the BERA and ABR methods. And if this hearing loss is confirmed, then we install a hearing aid to a child up to 1 year of age. By means of this hearing aid, we try to stimulate the development of the brain area responsible for hearing, and even if it's imperfect sound, it doesn't matter, it can be just noise, it's already good. But when the child achieves 1 year of age, we need to install a cochlear implant, because otherwise this area of the cortex will be used for other purposes, such as vision. So the earlier we are able to install the cochlear implant, the better. Right now, there is an age limitation in our country. The minimal age for cochlear implants is 1 year of age. But if we install the implant at a later stage, such as 4 or 5 years of age, the child will benefit much less, because they will lose this important period of neuroplasticity. Of course, they will also get some benefit, but they will not achieve the same level of speech as the children who had the implants installed at 1 year of age. But what if a child has the hearing loss of 70 decibel in one ear and 90 decibel in another ear? Will the implant be installed? Yes, we install implants to children with hearing loss of 90 decibel in one ear and 70 decibel in another. And in our country, we are right now using the installation of implants on both ears simultaneously. If there are certain problems with the anesthesia, we are install the implants one by one, but usually they are installed simultaneously. So the implant is installed if there is a development of hearing loss, and if it is over 80 decibel, and the patient has no speech impediments, but has some articulation impediments, but still the patient can read the lips. So the patient is suitable for a cochlear implant. But if the patient was not introduced to the implants earlier, and there is no development in the post-operation period, then even the best cochlear implant will not provide any results. So for adults, we say that there should be at least some minimal hearing in the person, and the person needs to be able to speak, at least to make some short sentences and to read lips. But we expect to get some response to sound stimulation. In case we do not get any response, unfortunately, such a patient will not benefit from an implant. And when can we say that cochlear implants are needed urgently? Well, here I would like to point out meningitis. If meningitis entails hearing loss, the person needs to get a hearing implant very quickly, because otherwise, if the person develops cochlear otosclerosis, unfortunately, in such a case, the cochlear implant will not help, and we will need to install a brainstem implant. So in case of meningitis and meningitis-related hearing loss, when we observe the implants on the inner ear, we need to install the cochlear implant as fast as possible, because if there is atosclerosis, the quality of tissues in the place of installation of the electrodes deteriorates, and we will not be able to accomplish a positive result later. So this is influenced by the condition which is called by inner otitis, and there are some techniques which are used on the inner ear, but unfortunately even this is not sufficiently successful. So there is a use in installing implants earlier. Also, there is another indication of toxicity when the hearing cells are damaged by some medicines, and we are then trying to restore hearing by means of a hearing aid or a cochlear implant. If it is a developed stage of hearing loss, we see that there will be no use of using a hearing aid, and we recommend a cochlear implant. There is one more thing to know. If the ear has been injured and the liquids in the ear have been mixed, the cells do not work anymore, a cochlear implant can be recommended if the labyrinth is still intact. If a child did not have hearing problems in early childhood, but then because of jaundice or other diseases had their hearing harmed, but then such methods as BERA and IBR need to be used to test the hearing system, and if the hearing loss is considerable, the cochlear implants need to be installed. Also, there is a different problem, which is hearing neuropathia, and sometimes the issue is a more complicated one. It's about the internal conductivity of the neurons. So in this case, we need to provide a more in-depth observation of the patient. So if the signal is obtained from the inner ear, we can say that the inner ear is functional. But if there is a problem in the connection between the inner ear and the neuron, then the patient has hearing neuropathia. And we recommend such patients to use a hearing aid for some time, and if the patient does not get any benefit from it, usually we recommend a cochlear implant, and usually the patient benefits much more. Menieres disease is the disease of inner ear, which is accompanied by vertigo and hearing loss. Unfortunately, in such patients, the loss of hearing progresses and becomes permanent. The patient is not getting any benefit from a hearing aid, and so in such cases we recommend cochlear implants, and we are noticing that the patients get the reduction of tinnitus in such cases. Also, patients with presbyacusis are the most often operated on type of patients after children with conductive hearing problems. Usually, such patients say that they hear people talking to them, they hear the sound, but they cannot understand what exactly is being said. So they have problems with processing the sound, and in such cases, cochlear implants are quite effective. The patients who were using hearing aids before and then installed the cochlear implant, they are noticing much better benefits from the implant, and also we are noticing the improvement of their speech. Quite often patients believe that cochlear implants are only installed in children, but actually that's not true. Anyone from age 7 to 77 can have a cochlear implant installed, and that's not a complicated operation. It takes about 2 hours to install an implant, and the post-operative period is not very problematic. It takes a couple of days for the patient to come back to their normal life. It takes about 1 week for the ear to recover, and we install the outer part on the 15th day. In the first 6 months there are some distortions of sound, but over time the brain learns to code the sound received from the implant, and the quality improves. Right now there are many developments about the built-in electrodes, and quite recently perimodal electrodes became more popular because they are closer to the nerve endings and they do not spread unnecessary signals around them. They are slightly more expensive, but perimodal electrodes produce better results with speech and articulation. There are some contraindications for cochlear implants. If there is some problem with the cochlear nerve, or if there is no cochlear nerve, if it was cut surgically when operating on some tumor, and this unfortunately is a contraindication. In such case, we recommend a brainstem implant. In our center, the brainstem implants are also available. There are also some conditional contraindications, such as the chronic otitis. If in the postlingual period there is no development of speech and hearing, such patients will not benefit even from the best implants. That's the end of my presentation. Thank you very much for your attention, and once again I would like to emphasize that cochlear implants are the treatments used around the world. The contraindications are very limited right now, and we are observing wonderful results in the patients, and we can see that healthcare is moving forward very fast, because cochlear implants is the only type of operation that can in essence substitute the ear. And if the cochlear implant is installed on time, the patients hear well and can speak just as any one of us. And we can see that if the cochlear implants were installed in early childhood, we can see that over time it becomes impossible to notice from the person's hearing and speech the fact that they are using an implant, because they have perfect hearing and articulation.